So if glutathione is so important, why isn't anybody talking about it? The answer is fairly simple and straightforward. While there has been a great fascination with glutathione from a clinical and research standpoint, there has never been a sustainable or significant way to raise glutathione levels within the cell. While you can buy whole glutathione supplements, it has long been understood by scientists and researchers that supplementation with whole glutathione makes little difference, if any at all. It's well documented that glutathione sold as a dietary supplement is mostly destroyed through digestion and therefore is of little or no use. Another popular form of glutathione therapy is based on intravenous administration of glutathione into the bloodstream. While there are some transient and immediate benefits from having a powerful antioxidant like glutathione circulating, the cell does not have a receptor to receive glutathione, and generally speaking, there is no mechanism for it to enter into the cell where it belongs and does its best work. Within a few days, intravenous glutathione is processed out of the body, providing little to no long-term impact. A few other glutathione-stimulating products have been marketed as dietary supplements, but all have made only a modest impact as far as raising glutathione levels in the cell. For instance, a number of glutathione stimulators use undenatured whey protein to provide the amino acid cysteine, which is the rate-limiting factor in glutathione production. At best, however, these methods might raise glutathione levels 20 to 40% if used continuously over the long term. Recently, two breakthroughs in glutathione supplementation were made by Dr. Robert Keller and Dr. Herbert Nagasawa. Dr. Robert Keller, a triple board certified physician, faculty member at the Mayo Graduate School of Medicine, and named one of the 2,000 outstanding scientists of the 21st century by the Cambridge Registry, was the first to crack the code on glutathione. His nutritional formulation for raising glutathione relied on strategic delivery of the precursor building blocks so that they would be absorbed by the cell and then assimilated into glutathione within the cells according to the cell's own wisdom. This formulation showed an increase in glutathione of 292% in human clinical trials. The results were so impressive that they were even presented at the prestigious American Academy of Anti-Aging Medicine 16th Conference in Washington, D.C. Max International, a U.S.-based company, acquired exclusive rights to develop and market Dr. Keller's formulation, and in 2007 brought it to market under the product name Max GXL. Simultaneously, Dr. Herbert Nagasawa, a 40-year medicinal chemist who had authored over 160 peer-reviewed and published medical articles and studies, who also served as the senior editor of the Journal of Medicinal Chemistry for 32 years and considered by many the world's leading authority on glutathione, had made another astounding breakthrough in glutathione technology. He designed a proprietary molecule called ribosine that protected cysteine through digestion and delivered it to the cell. Since cysteine is the rate-limiting factor for glutathione production, ribosine elegantly solved this problem using a nutritional solution that once again left the cell completely in charge of how much glutathione to produce and when to produce it. Upon its introduction, ribosine, validated by 18 peer-reviewed clinical studies, all funded by the prestigious National Institute of Health and Veterans Administration, and also protected by 24 patents and patents pending, became the premier cysteine delivery mechanism and glutathione support product on the market. Like Dr. Keller, Dr. Nagasawa chose Max International as his exclusive partner to bring this technology to the world. Today, ribosine is available exclusively through Max International under the product name Max 1. Through acquisition of Dr. Keller and Dr. Nagasawa's glutathione-enhancing technologies, Max International owns the exclusive and elite technology to raise glutathione intracellularly more than any other products commercially available. What many people report after using Max GXL or Max 1 for 30 to 60 days are more overall energy, cellular detoxification, better mood, improved mental clarity and focus, increased athletic performance, reduced recovery times, deeper sleep, and fewer aches and pains from inflammatory-driven conditions or injuries, just to name a few. If you would like to try Max 1 or Max GXL, contact the persons who directed you to this video to learn how you can purchase these amazing breakthrough products.